people letting their guard down and they're getting infected and they're giving it to their families.
As we average some 60,000 new cases and 700 deaths a day.
The vast majority of Minnesota's COVID-19 deaths are cases associated with long-term care facilities.
A 3 to 6 month delay for essential items, including those critical.
Bethesda Hospital, not far from the state capitol. mHealth Fairview now in the process of transforming this into a dedicated COVID-19 care facility.
My name is Jason Cotton-Cannon. I'm the nurse manager for the Med-Surg ICU unit at Fairview Northland Hospital. COVID has impacted every single day since it became a thing. I wanted to go be a part of whatever was taking place. I was seeing what was going on in New York. I wanted to go contribute to that somehow. Didn't really know how that was going to look. I had an opportunity to go to Bethesda. I originally went there with the intention of being a nurse, providing patient care. And that quickly became apparent that my technical skills were not what was needed. I ended up in a leadership role. It was made up of individuals throughout all of the health system, including nurses from throughout the entire country. My clinical background is in a community hospital, and to walk into this environment where they were patients sicker than I had ever seen before, but to see this group of individuals coming together as a team to provide the care that they were providing was impactful. There was a pureness to what was being done. You absolutely had to trust the people that were around you, even though you didn't know them. Compared to where I come from, where we've largely all worked together and know each other very, very closely. These were people that didn't know each other the day before, and they had to work very, very closely together, and they had to rely on each other. There was an entire hotel that was just remodeled and had been exclusively contracted to provide lodging for the staff at Bethesda. I would stay there periodically, and I would notice in this very nicely remodeled and recently refinished hotel, pairs of shoes outside random doors, and it just became something that I started to recognize, and it really did. We're nurses. We deal with bugs and a lot of stuff we don't want to bring home, but there was something that I noticed about so many nurses that are there for the same reason, staying in a hotel, which meant many are obviously away from home, so much further away from home, but there would just be pairs of shoes kind of randomly, and it stood out for me that it was indicative of who was in the building, but then also said something about, I don't want to bring that into the room, or some concern and lack of knowing about what they were facing.
My name is Jennifer Negley, and I am a nurse on a medical cardiology PCU. We were not prepared for this at all. I work in a very good hospital. I'm proud to work there, and we ran out of everything. We ran out of hand sanitizer, wipes, gowns, gloves. We went from worried about that we were not going to have enough staff or not going to have enough PPE to the second option, which we were worried about not having a job. And they talked about furloughing us. I thought I had a secure job. before this, and I was worried, was I gonna go back? If when I went back, is my hours gonna be cut? I'm pretty much the breadwinner for the family. My husband actually took a job right after our honeymoon with lesser hours because we could live off my income. The patients, mostly when they came back, when the COVID kind of settled down on my floor, we had a lot of patients that came in more sick than ever because they weren't getting primary care. They couldn't get to visits. They were afraid. And so like as a nurse, I always try to think of like ways now to like educate them. Like if you're home and you can't get here, I know telehealth has been really huge, but just different ways to access them, because I mean, we had patients coming in like very sick from not seeing anybody. We've had patients passing away and family members couldn't come in to see them. And you're trying to figure out how to get on the iPad or trying to call them or FaceTime or whatever you could do. You know, nobody wants to die alone. Regardless, even if you don't have nobody in your life, you still shouldn't die alone. So that was kind of the tough thing when there no visitors were allowed, was a lot of people were lonely and a lot of people were depressed and they couldn't get a hold of their family members. So that's the kind of stuff that makes me sad. And maybe in the future, if this happens again, there's a better way that we could make sure that these people are not alone.
My name is Hans-Peter de Ruyter, and I'm professor at Minnesota State Mankato. We have a total of 270 international nursing students who are working together online. And one of the beauties is that there's no cost for any of the universities. Students just need internet access, and we link them together. We share their emails with each other, and they do the rest of the work. They connect with each other.
My name is Eva de Jong. I'm 21 years old and I live in the Netherlands.
Oh, the pandemic has really made this flourish. So this happened before the pandemic that we got started with this, and all of a sudden kind of the bottom fell out of the nursing programs, in that we couldn't meet on campus and everything. And this module was in place, and all of a sudden the students started having face-to-face contact and talking about the same pandemic in different parts of the world. So American students or Minnesotan students were talking to students in South Africa. They were talking to students in the Netherlands and in Austria and in the United Kingdom.
You said you work at a clinic. Like, how do you guys like take care of like COVID patients right now? Like, how is COVID?
And that really put the learning that they had, but also their own experience, within a global perspective. This semester we have some students that are working with a student in the United Kingdom who just got admitted to the hospital with COVID, and they're actually following this other student and trying to learn at the same time being empathetic. So actually now the Minnesotan students are really following a student in the United Kingdom who's in the hospital and going to the experience, and in the same time learning about the differences in the health systems, yet at the same time the common problem that we have with COVID. It is that relating, that's what we try to use as a part of creating nurses for the future, because they can do that with the patients in the hospital as well, or with people who are very different. So it's really in the suffering sometimes that we experience that we can find common ground. It's not something that we're saying, oh, this is just limited to Minnesota State Mankato. It's open to any university or college or nursing school that says, hey, this might just work for us. And it's also giving the students an exposure to diversity, which sometimes is harder to do when we're in our comfort zone at home. Here, they have to work together, and they also have to explain their situation here, which offers an opportunity to really get to know other nurses and nursing students in a way that is much harder to do in everyday life here. And hopefully that skill set is going to translate when they go into practice here and encounter people from different backgrounds.
I'm Sarah McCumber. I'm a geriatric and family nurse practitioner at Essentia Health in Duluth. The way that I deliver healthcare has been changed tremendously. Used to see all my patients face to face. Now for a while I saw all my patients virtually, basically through telephone or video visits. Now I'm seeing about half of my patients through video visits. So my in-person care has changed dramatically. Okay, so the good has been that patients who have difficulty getting out of their homes or mobility issues or who have health conditions are able to be seen and get their needs met. So that's been a positive. Where one of the bad things is that sometimes people don't have access to technology, particularly for doing video visits. Some people only have access to the phone, and it's difficult to do a full exam and history and as effective care as you want over the phone. So it's technology, access to the internet, especially because I deal with some folks in rural areas. Well, personally, it's been very nerve-wracking. I think I kind of actually went into a slight depression because I felt like everything was just so dramatically changed, and that was very difficult. And it's also been a little bit isolating, so that's been difficult. We have been working to move telehealth forward for our patients, and it's been taking small steps, and suddenly we have probably leaped decades forward in our delivery of healthcare. So to me, that's positive, and I'm also doing that with my students. My students are learning about telehealth, so I think that is a positive thing. The other message is that we need to really pay attention to public health principles, and I think we as a country and as a profession had not always been as up to date about paying attention to public health. And my third message would be that this disease has brought out a lot of the health disparities in our communities and the people that we work with, and so that we need to be much more sensitive to the social conditions that our patients and our colleagues are in, and we may need to be more politically active and consider that as we develop our treatment plans.
Brett Anderson. I'm the Chief Ecosystem and Operations Officer for Ecumen, a senior housing and service provider. I think in many ways you've heard the terms unprecedented, and every day has certainly been filled with numerous challenges. In long-term care, our teams and our nurses have been at the front line, on the front line from the beginning. Long-term care has been the epicenter of the pandemic. And so while it's unprecedented in that standpoint, there has also been a lot of good things that have come out of the pandemic as well. Some of the significant challenges our teams and our nurses have had to face is regulation has changed every day. New challenges have come almost by the hour. And one of the biggest challenges has been having to close our doors. Nurses in long-term care and assisted living and other senior housing settings have not only had to respond to the challenges of the pandemic and keeping people safe, they've also had to change and innovate and find ways to keep those that they serve and care about connected with their family members and with their loved ones. And in those challenges have come really positive innovations, and nurses have been able to show their creativity, and they've been able to find solutions to those problems to help keep people safe and also keep their residents connected with family members and loved ones. Nurses haven't forgot about their ability to support each other, to support their team members, and most importantly, to support those that they care for. And I have seen so many amazing acts of kindness and support from nurses in my organization and nurses in other organizations to come together to support each other and to not forget that we do our best when we work together.
My name is Stephanie Gingrich, and I am a clinical assistant professor at the University of Minnesota in the baccalaureate, the master's, and the doctoral programs in the School of Nursing. I'm actually seeing that the nursing students are more engaged in the content. It's really real. They can see the impact directly on their families. They are watching their communities struggle with COVID-19 and be able to learn the content right away and apply it in their communities and their families. So they're really engaged, really interested in the work, and even more empowered to be successful, to be nurses, and be able to impact the communities they serve and see it in a different way than maybe they had started when they first started the program. You know, students are incredibly resilient, but being in a nursing program is rigorous and intensive already. So they have a lot of questions, and they have a lot of impact that's happening in their world. And one of the things that we talk about a lot is how nursing profession isn't just taking care of the patient in front of you, but you take care of the patient, you take care of the patient's family, the community they come from, the state they're within, and even look at national impacts. And so nursing students are really getting a lot of context around the content that they're learning and being able to immediately apply the learnings, which is incredibly impactful to their career.